Welcome to FCC Knows.
Hey, welcome back to FCC Knows. If you're new here, go ahead and hit the subscribe button now. Today we are talking about PTSD, so post-traumatic stress disorder. We just mentioned in our recent video about what it is, how you get it, and today we want to talk about some of the symptoms and some of the things that you can do to help with the symptoms. But you know, one of the things that we noticed in our first video is that this is a really difficult subject to talk about. Yeah. There's so much information out there, and it's a very unique experience as well, just depending on some of the triggers that you might have, which we're going to talk about, and the way that you learn to cope with it. And so as we're talking about this, these are just some things in general for you to consider about PTSD, but it may not speak to your specific experience. So the biggest thing that we want to be able to offer you today is just for you to know that there is ways to cope with this. And sometimes we overgeneralize and feel like this is something that just happens to people that go to war. This just happens to people who experience some sort of severe trauma. And that's not always the case. Sometimes it's a very different experience. And so hopefully you find something that you can connect with in this video to help you if these are things that you're experiencing. So I'm going to go ahead and pass it on to y'all now.
All right. Well, and like she was just saying, since it is such a difficult topic to talk about, we want to be able to break some things down for you to be able to allow you to kind of process through and think about if it's something that taps into how you're feeling. So there are several different types of symptoms that you can experience from PTSD. I'm just going to share a few of them with you. Some of the big ones include, for instance, of course, if you have experienced some traumatic event, also if you're having nightmares or flashbacks in relation to that event that occurred. It may be a case where you notice when you do see things that trigger you, you avoid those situations. You want to stay away from people maybe that was involved in that situation, movies, things like that. So avoidance of some form, some sort. You may have some difficulties when it comes to sleeping because you're having, again, these dreams about the things that occurred in your life. There may be some poor concentration. There may be things where days you're not really feeling like you want to eat. It may just be a lot of mixture of emotions that you will experience. You may start to feel really, really nervous in certain situations and you can't pinpoint why. So if you do notice any of these type of symptoms and you know as well that you've experienced a traumatic event or multiple traumatic events, please be sure to listen up to some of the things we have for coping and listen up for ways that you could be able to reach out to someone that may be able to help you through this.
Some of the coping skills that I always tell my clients are like deep breathing. Everybody thinks that's so generic, but I do something very simple because I go to Wendy's a lot and I get 4 for 4s. So it's easy to remember for 4 seconds. You inhale for 4 seconds, hold it for 4 seconds, and then let it go. But really, you're supposed to kind of exhale for longer if you can, but that's a good quick way to start. And deep breathing is not just in your chest. It's like from your abdomen, so from your diaphragm. So a good way to practice that is just to hold your abdomen and like let it fill up and feel it, you'll feel it expand. So another thing that you can do is join a PTSD group. I know here at our agency we do have a PTSD group. It's mainly for veterans right now, but find one in your local community to just join and just be able to connect with other people that have gone through something similar as you. Another thing you can do, another generic type of thing, is exercise. Exercise and get involved in other activities. I know Christy mentioned that you may have a trigger of not wanting to be around people because it's a depressive type symptom as far as isolating yourself, but the most important thing you could do is still connect and be around people and do some activities. Another thing is there's some free apps. I know everybody has a phone. So if you have a phone, download a free app. It's called PTSD Coach. There's also one for a family. It's a really good app that you can use because you just put in like what your symptoms are. It'll ask you, it prompts you for everything. And then it even goes to the point of oh, you need to call somebody right now, like call 911 or whatever. But it also has some quick little like calm down exercises and relaxation techniques that you can use. The other thing that you can do is confide in a person that you know. So if you know someone that you trust anyway, like, so these are my girls, I trust them, I would talk to them if I, you know, and then they can know, like, Wanda, you need to go get some help. So then they can do that. And then another thing that you can do, especially if you're experiencing suicidal or homicidal type feelings, then or thoughts, you can definitely call 911. Please, by all means, call 911 and or go to your nearest emergency room and get some help right away.
So really, one thing that you said that just to throw out there about the PTSD process, finding that safe person, and sometimes it's hard to find those safe people. Sometimes we go to close friends or family, and they don't always know what's happening. And so if you ever find yourself talking with someone and you feel like they are maybe minimizing the things that you're experiencing or trying to give you a quick fix for how to do that, and it still doesn't work, then you're probably going to want to talk with a therapist and reach out for that kind of help. Only because we're going to be able to give you that additional coping skills and teach you those things that you wouldn't have necessarily otherwise. So that's what it made me think of when you talked about finding a safe person. Like, sometimes we don't always all have that.
Right.
Or sometimes family members and friends are actually the people who were unsafe to begin with.
Right. Right.
And so, yeah, just considering all those different experiences.
And then if you want to, you can check down below, because we'll post some phone numbers that you may call. The ones that we have right now are like our Georgia Crisis and Access line, and they have mobile people that can come out to you. And we'll put the National Suicide Prevention line. If you are a veteran, you could just press 1 and be automatically connected to someone that can help you. I also put like the deaf and hard of hearing phone number, and also in Spanish, because that's all we got right now. But definitely call, and I'll put those links below. Also, we have our newsletter that we have, FCC Knows Mental Health. So that link will be down there too, with a lot of the information that we just talked about, as well as the numbers as well. It's all on there, so you can just download that. So thank you all for watching. Don't forget to
Like,
comment,
and subscribe. Hit that bell too.